that it has been a bipartisan effort, particularly the work of Senator Curran, who is not only very knowledgeable about elections, but also the Department of Revenue, and also Senator Westland. We've been working on this bill through the Elections Committee last year, then into the tax bill, and then not being successful there in the final conference committee report. We bring it before the Committee on Judiciary and Public Safety yet once again. And the reason why it needs to come to Judiciary and the Judiciary and Public Safety's Committee's jurisdiction is lines, starting with lines 1.18, the administration of the refund, the Campaign Finance Board requests that it have access or use data that is entered and stored in that system that will be set up by the Department of Revenue, and the characterization of that data is indicated on lines 2.1 and 2.2 that it is private data on individuals. It would due to be in place as of January 1 of 2027.
Thank you, Senator Rust. Members, I'll note there's some materials in your packet as well relating to this bill. Is there anyone else in the room wish to testify in connection with Senate File 9? Senator Limmer.
Thank you, Mr. Chairman. Senator Rust, I too am a member of the Elections Committee, and I did not, as I've been thinking of this bill, I don't know if there was a discussion about the minimum dollar amount that is now changed in this bill for reporting a contribution to a political campaign. It now recognizes a minimum of $10 and up. Could you tell me how did you arrive at the $10 mark instead of just any donation?
Senator Rust.
Mr. Chairman and Senator Limmer, we had a lengthy, actually, discussion on this in the Elections Committee, and I wish that Senator Curran was here because he's the one that worked that out and how it's going to be more efficient for the system. The actual receipts can be issued all through the year. It's only that when you get to $10 that with those receipts that you are eligible to apply for the refund, and then it is up to the system itself, the electronic system itself, to add up those contributions and determine electronically whether you still have $65 left as an individual or not. The system would shut you down if you gave more than that. At the point of you only get $75 in a refund. And I would point out that there was discussion and Senator Limmer, maybe you weren't there when I presented the bill. this year in elections, I don't recall. But it started out also, and then was amended in the Elections Committee to be a report having to be made every week, I believe. And then Mr. Sigurdsson from the Campaign Finance Board said, once the system is up, it certainly can be, it can be even faster than that. So that language was changed in the Elections Committee to be once every day at least. And Mr. Sigurdsson said it could be even actually more frequent than that. It's just a matter of pushing send. That amount, though, Mr. Chairman, Senator Limmer, I don't see that as an issue in terms of the way in which the data is dealt with as an issue for the Judiciary Committee.
Mr. Chairman.
I'm happy to discuss it,
We're going to
but
entertain, you can follow up with a question, Senator Limmer, but the last question we'll entertain on the amount that's in there. We'll try to focus on our Judiciary Committee issues and
Thank you, Mr. Chair.
classification of the data, please.
I
Senator
appreciate that. Senator Rest, you were good at telling me how the system might work. Let me rephrase what I'm trying to get at. What's so magical about the $10 figure? Why didn't you just recognize any dollar donation?
Senator Rest.
thank you, Mr. Chairman. I guess, again, this was a suggestion that was brought by Senator Coran. He thought it was a reasonable number to have as a minimum, and the members of the Elections Committee did not object to that. It could have been $15. It could have been $7.50. He thought it was reasonable, and Senator Westland and I had no objection, so that's why the $10 got in.
Thank you.
Any questions or discussion from members of the committee on the data practices classification in the bill? Ms. Primo, anything we should know about the data classification here? Anything unusual about it we should be concerned about? Sorry, I surprised you.
Mr. Chair and members, I'll just point out there's also a data privacy classification on page 3, lines 5 through 7.
All right, any further discussion? Does this bill go to the floor from here? Taxes?
Mr. Chairman, that is
Senator
the,
Rust.
that is the, I should have pointed that out too. It's paragraph F, and the receipt validation report and the number prepared pursuant to this section are classified as non-public data as opposed to the earlier one, which is to classify it as private data.
Senator Rust, if we send this to the Taxes Committee, do you think it's going to get a hearing?
Maybe I'll just put it right in the bill without a hearing. Who knows? No, it'll get a hearing, sir.
All right. Senator Mover Benton?
Thank you, Mr. Chair. I move that Senate File 9 be recommended to pass and re-referred to the Committee on Taxes.
Any further discussion? All those in favor say aye. Aye. Opposed? Motion prevails. All right. Senator Rust, you have another bill before us. Senate File 11.
Yes, Mr. Chairman. Senate File 11 is a bill that adds a tax exemption to the, for sales tax to the, or 2 years ago, we added it to gun safes, and this year, this bill is adding a sales tax exemption to the purchase of a firearm safety device. It was pointed out that there's a need for a clarifying amendment, which is the A1 amendment, which I hope someone would offer. And it applies to page 2, line 5, after the comma, defining government entity as defined in section 1302 subdivision 7-8, which specifically defines a government entity as a state agency, a statewide system, or a political subdivision, just to make sure what we're referring to, and so we make the reference to the statute at section 1302.7a. Other than that, if that amendment is put on for clarification, the bill just adds firearm safety devices, and that means trigger locks that are placed on firearms. What it does not include is the sale of a firearm that already has embedded in it a firearm, a trigger lock on it. It has to be something that is separate, because we're not intending to offer a sales tax exemption to the purchase of a firearm in and of itself.
We have to adopt the amendments. Senator Anderson, you're holding that up. Would you like to move adoption of the A1 amendment? Senator Anderson moves adoption of the A1 amendment. Any discussion? All those in favor say aye. Aye. Opposed? Motion prevails. The amendment is adopted. Is there any discussion on Senate File 11 as amended? Senator Limmer.
Thank you, Mr. Chair. Senator Rest, oftentimes when we get in the subject of firearms or related subjects, it may attract other amendments, especially around the governing of firearms themselves. If such an amendment would be introduced, would you welcome that amendment, or would you resist that amendment?
Senator Rust.
Mr. Chairman and Senator Limmer, this is about firearm safety. And I would argue that anyone that wants to put anything on this bill that deals with a firearm itself would be ruled non-germane. This is about safety. This is about encouraging, if you will, those persons that see fit to purchase a firearm, that they get a break on the sales tax if they also purchase a gun safe, if they purchase a trigger lock, and they have that trigger lock attached to the firearm.
Okay, Mr. Chair.
Senator Limmer.
Thank you, Mr. Chair. Senator Rest, you and I agree. And just wanted to make sure that we clarified the direction of the bill. And I believe it's an encouragement to buy safety devices to secure firearms, wherever they may be. Thank you for the bill.
Mr. Chairman, Senator
Senator
Lummer,
Rust.
no one tried to mislead the body when it was in the 2023 tax bill and it was adopted there. Senator Drazkowski has given it last year we worked together to also, if you look on the second page, that information about the purchase or transfer of a firearm safety device, if it comes to be collected by a government entity, all data pertaining to that purchase or transfer is private data. So we also felt that that was a needed addition to the bill in order to, once again, encourage people to have trigger locks on their, and gun safety lock boxes.
Any further discussion from members of the committee, particularly about the data practices classification on page 2 of the bill? I'm not seeing any. Senator Rust, you want this sent back to taxes?
Yes, Mr. Chairman.
All right, members, I'll note there is a letter of support in your packet from the National Shooting Sports Foundation as well. All right, Senator Pappas.
Thank you, Mr. Chairman. I'm sorry, did we add the amendment?
We did, yes.
Okay. Then I'm happy to move the bill as amended.
Senator Pappas moves that Senate File 11 as amended be recommended to pass and be re-referred to the Senate Taxes Committee. All those in favor say aye.
Aye.
Opposed? Motion prevails. Thank you, Senator Rust. While we have a moment, Senator Utke can come on forward for Senate File 456. We have our new member of the Judiciary Committee, Senator Clark, has joined us today. Welcome to the Judiciary Committee. I'm told that you requested this assignment.
I did, Mr. Chair, I did, and I was warned. But I enjoy the work and am happy to join you all, so thank you for the welcome.
Glad to have you here. I've heard some of your best friends are lawyers, so you'll fit in well.
I hope to make a few more friends, Mr. Chair.
Thank you. Senator Utke, Senate File 456. Why don't you go ahead and give us a brief description of your bill, please?
Okay, thank you, Mr. Chair, members. You know what, Mr. Chair, if it's okay with you, we have joining us via Zoom, Sebastian Mesa, and I think there's a time constraint to that, so if we could get the testimony first, we'd make sure we get that in, and then we can finish up with the amendment once we get to that point.
Let me just ask, this is the first stop for the committee, for the bill, right? We have an A1 amendment for the effective date, be in the nature of an author's amendment.
That is correct.
Senator Luberbett moves adoption of the A1 author's amendment. All those in favor say aye.
Aye.
Opposed? Motion prevails. The amendment is adopted. All right, Sebastian Mesa, thank you for joining us. Welcome to the committee. Can you hear us all right?
I hear you, Senator, very poorly. I was hearing you well just a moment ago.
All right, well, I should turn the
There we
mic
go.
on here. It'd be easier. Can you hear me now?
Yes, I can, Senator. Thank you.
Okay, we can hear you. So why don't you go ahead and tell us what you'd like us to know about the bill?
Perfect. Well, thank you, senators, for the opportunity to speak to you, and for Senator Utke for sponsoring SF 456. Essentially, what this bill does is something I think that's been needed for many years now. As this committee is aware, Minnesota, other states around the country are grappling with an opioid crisis and a crisis of substance abuse. We have in our Minnesota statutes important work by our legislature in Statute 152-137 that recognizes the danger of methamphetamine in its production and rightly seeks to protect children and vulnerable adults who cannot protect themselves from its hazardous and harmful effects. However, in recent years, the introduction of fentanyl to our communities has proven that drug to be even more dangerous and destructive than methamphetamine. According to some research from the University of Minnesota School of Public Health, fentanyl overdose deaths in our state have roughly tripled between 2019 and 2022. That drug, as I'm sure you senators are aware, is far more toxic, far more dangerous than methamphetamine. Even slight exposure to it can cause seriously harmful health effects, death, overdose, and that can be through just contact with the skin, inhaling a powder or dust. We recently had a case here in Aiken County where a young child, unfortunately, through the negligence of his caretakers, was exposed to fentanyl, had to be given 3 Narcan doses, resuscitated, airlifted to Minnesota Children's, and had it not been for those first responders, the quick actions of law enforcement, and obviously the medical attention that that child received, we would have had another tragedy. I think that we should not wait for these tragedies to repeat themselves before we update Section 152, 137 to recognize the dangers of fentanyl. And so I'd ask the committee members to please recognize the thoughtful work that SF 456 attempts to accomplish. And again, thank you to Senator Utke for the opportunity to speak to you all and for sponsoring this bill.
And you may have said this already, but could you go ahead and just identify your formal position as well?
Yes, of course, Senator. I am an assistant county attorney for Aiken County. My elected is James Ratz, and he also supports and endorses this bill.
Thank you. And
Thank you.
members, just for the record, you do have in your committee packet a letter from County Attorney Ratz in support of this proposal as well. And just so you know, because there is a possible fiscal implication, we are waiting for fiscal analysis to come back about possible bed counts as we go through the process for all of our proposals for new crimes. So the intent will be to lay this measure over until at least we get that. All right, are there any questions for Assistant County Attorney Mesa? Thank you. You seem to have covered the territory well. Thank you for joining us. You're welcome to stay on and watch the rest of the hearing if you wish, or you're free to signal off and do your other work. Thank you for joining us today.
I'll do that. Thank you, Senators. I appreciate your time.
Thank you. Is there anyone else in the room that wished to testify in connection with this bill? Not seeing anyone. Senator Utke, thank you for pointing out that Assistant County Attorney Mesa has some other work to do here, but now's your chance. What would you like to say about your proposal today?
Okay, thank you, Mr. Chair. And yeah, we knew we had a limited number of times. I'm glad we were able to get them on. And actually, just to clarify, I think that the letter that you all have in your packets, like I've got too, was actually signed by Sebastian. You know, the top of the letterhead does list the county attorney, but so they're in this together. But a little background, this all started back in late 2023 when I first got the first email from Sebastian pointing out this where a statute just kind of dropped the ball on fentanyl and needing to kind of refresh our statute because of what fentanyl has done in the last number of years. And so this brings it up in line with methamphetamines and all of those things that we've dealt with over the last handful or a dozen plus years that have created a major problem for us. We don't have to go any further than our TV screens and look at what's happening across our country and, the topic of Canada and Mexico. What's driving that topic today? It's fentanyl coming across our borders. So it is hugely important, and that's what led us to this bill that's before you. And I hope that we can see progress with this, and it'd be nice to put this in place because the county attorneys are just asking for this tool in their toolbox to be able to prosecute the people in the proper manner and also protect those that are being harmed from this bad product. So with that, I would stand for any questions.
Senator Pappas.
Thank you, Mr. Chair, and thank you, Senator Utke, for bringing this bill forward. It's very timely. Just a week or so ago, there was a child in St. Paul that had been exposed to fentanyl because of parental use. And so I really appreciate the bill and would like to be a co-author. Thank you.
Thank you.
Senator Anderson.
Thank you, Mr. Chair. Senator Utke, I thought about the statement that Mr. Mesa mentioned about the tripling of fentanyl deaths since 2019. Do you have any statistics of, say, in 23 or just last year, how much more fentanyl deaths have occurred?
Senator Utke.
Mr. Chair and Senator Anderson, I do not. I've actually only got the information that you've got in front of you and which Sebastian read from because, that's the most current I've got. I'm sure there's stuff out there. I just haven't gone digging for it. But I'm sure it's unfortunately done nothing but increase. And that's what we're hoping to head that off and turn this thing around.
Mr. Chair.
Senator Anderson.
Thank you. Mr. Chair, Senator Utke, if you have a chance to talk with with the Assistant County Attorney Mesa, if he's got any other information to add to what he's given to us as far as for 2023, this just goes through 2022. I'd like to know how much more effects as far as deaths that have been contributed to fentanyl. That would be a good avenue. So thank you.
Okay, I'll dig into that.
So members, my understanding is that since June of 2023, so now almost 2 years ago, the fatal overdoses from fentanyl and other street drugs have fallen nationally by over 21%. No doubt fentanyl is a devastating drug and is a very serious threat to public safety, but we should at least be clear-eyed about we've got the trend going in the right direction, and a very small proportion of fentanyl comes over the border from Canada. The rest of it tends to come through legal ports of entry brought in by U.S. citizens who are trafficking it. So just since the topic was brought up by the testifier about the borders and the impact there, that's not really the subject for the discussion here today, but I want to make sure the record was clear on that. Senator Kroon.
Thank you, Mr. Chair. According to the Department of Health dashboard, in 2023, there was over 1,000 deaths caused by fentanyl.
No doubt it's a serious problem. Any further discussion on this bill before we lay it over? All right. Thank you, Senator Utke. Appreciate you being here today and bringing the bill forward.
Thank you very much.
Senator Anderson. Yes, we adopted the amendment as an author's amendment at the very beginning. Thank you. All right, Senate File 456 is laid on the table. All right, Commissioner Schnell, come on forward. We're going to hear from the Department of Corrections.
Thank you so much, Mr. Chair, Chair Latz, and members of the committee. My name is Paul Schnell, and I'm the Commissioner of the Minnesota Department of Corrections. Thank you for having me here today and the opportunity to provide an overview of the important work of the Department of Corrections and the agency's budget request for the next biennium. I'm honored to have the chance to work with all of you, and I look forward to meeting with each of you individually during the course of the session. Please know that you can always reach out to me, our staff, both Kelly Hoff, who is here, the interim director of Legislative Affairs, and Deputy Commissioner Safia Khan, who many of you know. The Department of Corrections mission is to transform lives for a safer Minnesota. That work of the DOC plays a vital role in making and helping to keep Minnesota safe. Through successful rehabilitation, the agency endeavors to reduce recidivism, leading to fewer victims, less crime, and less fear in our communities, all while reducing costs to the state. We often hear about the need to break the cycle within the criminal justice system. The DOC, in collaboration with our corrections partners, is committed to doing exactly that. And we're doing that through our focus on rehabilitation, the use of evidence-based practices, successful reintegration, and the targeting of high-risk repeat offending. In the interest of time, I'm not going to go over this slide except to say that the department's strategic plan guides our work. I wanted you to have copies of the agency's strategic focus in your packets. The DOC is the third largest state agency with a complex set of responsibilities. Our work starts with creating and delivering individualized plans tailored to the unique needs of the individuals we serve. These plans are designed to help each individual succeed, whether that's through education, job training, mental health supports, substance use disorder treatment, so that when they return to their communities, they're prepared to be successful. Our efforts don't end when someone is released. We, along with our county partners, provide services in the community that will help individuals under community supervision build connections to establish positive support networks and ultimately increase their experience of positive reintegration. Our goal is to support lasting change, both in the individuals we serve and for the benefit of the communities they rejoin. The DOC has approximately 4,300 employees serving in our facilities, our central office, and in community supervision. The DOC operates 11 prisons with a combined bed capacity of 9,522, though that number reflects double bunking to accommodate a larger population. Currently, the state houses approximately 8,300 individuals. Our facility's footprint spans 7.5 million square feet. Beyond our prisons, the DOC provides supervision to approximately 20,000 individuals across the state in 13 district supervision offices. We also review and approve comp plans for county supervision partners, and the DOC is responsible for licensing county jails and providing risk assessments for community notification and the leveling of predatory offenders. Also, for your reference, this slide is a quick overview of the 11 facilities the DOC operates across the state. And I encourage you at any time to tour of the facilities and speak directly to the dedicated staff and the individuals who are incarcerated in them. A couple of references of note: the facility in Shakopee is the state's only women's prison. Red Wing is the state's secure juvenile correctional facility, housing them for treatment. And the St. Cloud facility serves as a central intake facility for men. Faribault is the state's largest facility with a population of just over 2,000 And the Togo site is the smallest facility, with being one of the two men's challenge incarceration boot camp facilities. The prisons in Stillwater and St. Cloud are both well over 100 years old. As many of you know, in this committee, we've heard me say this a number of times, but for those who are new, I want to stress the point that over 95% of the men and women in Minnesota's prisons will return to community neighborhoods across our state. Because of this, we must ensure that those in our care, custody, and control have access to services and supports needed, for the safety of our state depends upon it. Human dignity is a core principle in the Minnesota's correction systems. We are focused on putting people and their risk reduction in the center of what we do to ensure accountability for their crimes and opportunities for change. By creating multidisciplinary teams, we are able to collaborate and design services to target criminogenic needs to aid in change. And the research shows that this is what works. I want to be sure to point out that the DOC also provides community supervision, as was noted earlier, in many of the smaller counties across the state. Minnesota has 3 delivery systems, including the county probation offices, Community Corrections Act, and the DOC, and tribal supervision was added during the 2023 session. The DOC is proud to work with our community supervision partners who provide the majority of supervision services across the state. The DOC has a constitutional obligation to provide health care and maintain a base standard of living for those incarcerated under state law. The DOC, as you know, is a 24/7, 365 state agency. The work never stops, and neither do the dedicated staff who ensure our facilities remain safe, that victims are supported, and that individuals in our care are given the tools they need to transform their lives. This work is often hard, and the staff deserve a tremendous amount of credit for the contributions they make to the lives of those incarcerated, as well as the impact they have on the lasting public safety of our state. It is also important to note that 96% of the state's budget comes from the general fund, reflecting the significant public investment in our mission. With that responsibility, we strive to be transparent, responsive, and accountable in what we do, ensuring that our work aligns with the trust placed in us by the people of our state. Members, we are grateful for the elected leaders, such as all of you, who are invested also in making sure that our staff have the resources they need to produce the outcomes that are needed and expected by the people of our state. Correctional services have a direct impact on public safety, including crime reduction, fewer victims, and safer communities. A 1 percentage point reduction in the state's 3-year re-imprisonment rate would yield an estimated $5.4 million in cost avoided to the DOC, and an estimated $57.7 million in additional costs avoided to the state and society in general. This slide shares key data points that are helpful for having an understanding of the state's incarcerated population. I just want to point out a few. The average age of individuals incarcerated in our system is 39.9 years old, and our population is aging, much like the rest of our country. 68% of those incarcerated individuals are parents with minor children in the community. And as you can see in healthcare data, a significant portion of the incarcerated population in the DOC requires many mental health care, and many individuals face complex medical issues or both. Each of these data points reflects a unique and important challenge to your work as well as ours. We have been utilizing every tool available, as you know, for the last many years to recruit and retain staff, recognizing their critical role in the success of our agency. In 2023, the legislature passed a significant investment in both our staff and our operations, which included funding compensation increases and staff wellness initiatives. Through the collective bargaining agreements, staff received a much-needed pay increase to become competitive. Thanks to those efforts, the DOC is currently operating at a 97% level of staffing across the agency. We are also seeing a reduction in overtime due to this increased staffing, but the change has not been as significant as we would have liked. The primary contributing factors to overtime remains the number of people who require specialty medical care delegations and hospitalizations, which pull staff away from the facilities. That said, forced overtime is now de minimis, which has absolutely helped support staff retention. I do want to reiterate that not since well before 2019 have we seen staffing levels at the place they are today. Last month, the pilot program for body-worn cameras was implemented at both Lino Lakes and Shakopee and Stillwater. That pilot was funded by the legislature in the 2023 session and comports with findings from the 2020 OLA report, which highlighted the significant need to enhance data collection and invest in security technology. Additionally, the 2022 DOC Ombuds report on sexual assault in prisons also recommended that corrections officers be equipped with body cameras to better ensure fairness for both officers as well as the incarcerated population. The use of body cameras will help increase transparency in correctional settings, similar to what was seen and has been yielded in law enforcement. It will also improve investigation into assaults against our staff and allegations of staff use of force, ensuring that all parties are treated fairly and appropriately. In addition to body cameras, the DOC has implemented many other recommendations from the 2020 OLA report. This includes establishing the Office of Professional Accountability, reducing double bunking in the facilities, increasing communications with and among staff, and the many other initiatives as listed here. I'll now move into an overview of the DOC's budget request for the upcoming biennium and how these align with our goals and priorities. First, our operating deficiency request of $9 million to be able to close out FY 2025. With competitive compensation and costs associated with that, we are now able to attract and retain skilled employees, enabling us to offer vital programming and services that are central to our mission. This request is mainly driven by our remarkably high staffing levels, which we, as I said, have not seen since long before 2019. We were able to reduce the operating deficiency of nearly $42 million through a series of cost reduction measures, leaving us with a $9 million deficiency balance. The DOC did not request a supplemental budget last year, as we have traditionally done in many of the non-budget years in the past. The funding is necessary to ensure that we can maintain our essential staffing levels to address our programming and service level needs. For operating adjustment, the governor's budget recommendation includes $43.3 million for FY 26 and $66.9 million for FY 27 and each year thereafter. As we continue to maintain a larger, competitively compensated workforce, this increase is necessary to support associated staffing costs and ensure that we can meet our operational and safety and security needs effectively. The operating adjustment also covers increased food and utility costs driven by inflationary pressures. The next proposal included in the governor's budget is the sunsetting of the Sentence to Service, or STS, program at the close of the current fiscal year. The program provides an option for nonviolent incarcerated individuals sentenced to county jails to be sentenced to a period of supervised work in the community. However, county participation and crew size in the program have steadily decreased since 2019. The number of individuals completing STS in 2019 was about 5,600, and now that number is cut almost in half. The state covers 25% of the costs associated with the STS program, and the county covers the remainder. Given the reduction in STS crew size, the cost per client per day is increasing exponentially, calling into question our ongoing support of this program. By ending the DOC's contribution to STS, the state will realize an annual savings of $1.8 million. Counties can still choose to fund the STS program based upon the efficacy of those efforts in their particular county, but the staff and equipment costs would no longer be supported by the state. The next slide briefly mentions an item that you will see in our budget request is the bed costs associated with the governor's proposal to increase criminal penalty for theft of public funds. This is the fraud package. Those numbers are listed here for your reference, beginning with $12,000 for fiscal year 26, up to $145,000 through 2029. That concludes the budget request for with a fiscal impact for the state. The remaining proposals are budget neutral. First, I'd like to calls for expanding the mental health pilot program. Originally passed in 2023, this program allows counties to transfer individuals with serious and persistent mental illness who are incarcerated in local jails to the mental health unit at MCF Oak Park Heights for both housing and specialized care. Smaller jail facilities often lack the resources or availability of expertise to provide the necessary care for these individuals with serious and persistent mental health conditions. By transferring these individuals to the mental health unit, there is available 24/7 professional care so that we can ensure that they receive the proper treatment and have the care to meet their needs. This proposal would extend the program until August 1 of 2027. Additionally, we will need to change the voluntary consent to transfer requirement of the pilot and instead changing it to a referral from a licensed mental health professional to allow more people to qualify and to better assist sheriffs who cannot provide the level of care needed for some of these people that are currently in their county jails. Next is the Interstate Compact Unit, which is responsible for managing all interstate transfers of supervision under the Interstate Compact for Adult Offender Supervision. During the changes to the community supervision funding formula in 2023, the costs for the unit were not included in the new formula and structure. Currently, the Interstate Compact Unit is solely funded by prorating those costs across DOC supervision counties. Though the Interstate Compact Unit provides those services for all 87 counties. This proposal amends the statute to allow the cost of Interstate Compact to be shared across all counties, prorated based upon each county's share of the most recent population, probation population. This change will also help ensure that the financial burden of managing interstate compact supervision transfers is fairly managed and applied across all counties. The next proposal would address how supervision funds for tribal nations are distributed. Currently, the legislature allots $250,000 for the DOC to distribute to each tribal nation to provide community supervision or fund reentry services in their communities. However, the statute does not specify how the funds should be paid out. Each tribal nation must therefore enter into a joint powers agreement with the DOC, which is a costly and time-consuming process. The DOC proposes distributing these funds in the same manner as we do with counties to streamline the process and remove the requirement for a JPA. The language also clarifies what the funds could be spent on and requires a comprehensive plan be submitted to the DOC for how the money will be used, which is the same requirement as the counties. The next slide covers our other proposal, which I will briefly cover. First, we request to transfer certain appropriated program funds internally to align with the restructuring in the agency. Next, much of Rule 2940, which governs the work of the DOC's hearings and release unit, is either obsolete, duplicative, or already in Minnesota law. And the rulemaking process is costly and time-consuming. We request to repeal the rule and codification of the few provisions that remain. Lastly, we seek to expand the definition of correctional employee included in the fictitious emergency felony policy passed last session. The current definition only covers those physically working in a correctional facility and does not include supervision agents and other staff who are exposed to similar risk of retribution. The last area I'll cover today is an implementation update of some of the policy changes made during the past biennium. One of the largest being the Minnesota Rehabilitation and Reinvestment Act. As a reminder, the MRRA incentivizes incarcerated individuals to earn early release and/or supervision abatement. It changes the way Minnesota does corrections away from thinking about how much time a person serves to thinking about how they instead use that time. Beginning this week, we will publish MRA policies, including procedures for earned incentive release and supervision abatement. Within the next month, we will begin piloting retroactive review process and looking at how it works to find the key takeaways, best practices in areas that need tweaks or improvements. We will apply those insights to refine MRA protocols and procedures with a consecutive implementation of both retroactive and a review and full MRA implementation. By fall of this year, we estimate that MRA will be fully implemented for those coming into the system, and we will be continuing the process of retroactive review. This slide is not even a complete list of the other investments and policy changes made in 2023 and 2024. I'm grateful and appreciative for the hard work of DOC staff and our partners who've invested significantly in these efforts, and I'm also grateful for the hard work of this committee over the past several years. I won't be going through each item listed on this slide, but I'm happy to answer any questions here or to meet with members to discuss it at a different time. And with that, Mr. Chair or members, I would stand for any questions you or other members of the committee may have.
Thank you, Commissioner. I got a question or two for you about this. It sounds like one of the reasons you're seeking an operating deficiency is because you were more successful than projected in your hiring. Is that what I'm hearing?
Mr. Chair, that's correct. I think when we initially did our forecasting and we did not come in with a supplemental budget request, which has typically the DOC has done, we had forecasted our hiring in a certain pattern and trajectory. Instead, when the compensation increases, which were obviously much needed, went into effect, our ability to hire and importantly, retain corrections officers, which makes up the largest percentage of our workforce, happened much quicker. And that resulted in this $9 million deficiency.
So this was a good problem to have.
It's a
You
good
met your
problem to
staffing
have,
needs
yes.
more quickly than you thought you would.
Yes.
I also had a question about your STS program. I'm generally a big fan of STS programs. I see it on the county level all the time. And have you factored in whether or not there would be a bed impact if people who are not sentenced to STS as an alternative to being committed to the DOC for beds in the prisons, whether there'll be a bed impact?
Mr. Chair, we have talked about that. I think importantly, one of the distinctions is that this funding reduction is actually focused on the STS side, which really has been about managing the population in county jails historically. And if you look at the number of days that STS served in 2019, was over 15,000. Now it's less than a third of that. And so I think this has been a consequence over time. I think to your question specifically, ICWIC, the institutional work crews, that funding is not touched by this. And so that is really where the opportunity for programming for those who are incarcerated at the prison level is most impacted.
And then you were talking about your mental health unit and extending the pilot program. Are you looking also at expansion of the number of beds available for that, or is that not available, not a possibility?
Mr. Chair, we would like to, I think we targeted a small number of beds in the pilot. I think it really is dependent upon what the availability is. In conversations with many of the sheriffs, and we have taken a couple of cases where over the course of time, one of the biggest impediments to this has been the voluntary nature of this requirement, despite the fact that many of these people are being held and sitting in county jails waiting for a mental health bed at part of a Rule 20. And so we want to be able to address those needs. And this has been particularly a concern where there is a lot of violence associated with their mental illness. And so we think that this is one of the places or spaces we could be of assistance. The number of beds would really be focused on our availability and whether or not we can do that. The one case that we did take from one of the counties, which was really important to that particular county, that man remained with us for a considerable period of time. And so this is where it can be challenging for us to commit to a higher level of beds and then not have the bed space to deal with acute mental health needs of our own population. But we want to make sure we're working with the counties and our sheriff partners across the state to be able to meet those needs.
Commissioner, when you say the program is voluntary, what do you mean by that?
Mr. Chair, the way it was set up was that an individual who may require these services would have had to agree to go to Oak Park Heights as a part of this. The change that we would be making would make that through a referral of a qualified mental health professional who would be indicating that these services are required.
As you know, for many years, and including the sheriff's own presentation here this year, they're still struggling with complying with the 48-hour rule, getting people out of their facilities who have mental health needs, some of whom are staying even longer than a year, waiting for bed availability. And so any place we can find appropriate outlets to more appropriately house those folks and give them treatment, the better we'll all be. So appreciate your work on that. I understand Senator Pappas had a question?
Seems so far away today. Thank you, Mr. Chairman. I have two questions, if I may. Commissioner, I believe we limited probation to 5 years. What impact is that having on the number of people on probations or staffing or financing, or has it had much of an impact yet?
Commissioner.
Mr. Chair, Senator Pappas, it certainly has had a reduction. We have seen, I think, when I started in 2019, the numbers were over 100,000 under community supervision. Now we're in the 80s, lower 80s to mid 80s. So there has been a reduction. Now, I think what is most important about this is that the work around community supervision over the past several years has been really focused on making sure that we're targeting the needs of people and focused on the risk principle, which says that we should intensify the services we provide to those who have the highest risk of reoffending and the highest risk of violent reoffending. And I think that's really the benefit of this, is that our probation staff across the state are able to focus on those people who represent the highest risk.
Thank you, Mr. Chairman, and even on this topic, so, I would assume the low-risk people weren't receiving much supervision, even if they were under probation. So did the law work retroactively so that people who maybe were on probation for 10 years and were already 5 years through that process, were they then released from probation?
Commissioner Schnell.
Mr. Chair, Senator Pappas, yes, there was some reduction of those people who did as part of the statutory change that addressed that
Okay,
issue.
great. Then, Mr. Chairman, my
Senator
second
Pappas.
issue had to do with MRRA. As the Chair of Capital Investment, I'm very much aware of the shortage of programming space, and I'm sorry that we weren't able to move ahead with Rush City and Lino Lakes last year. Hope springs eternal that might happen this year. And I know the costs have gone up, and we'll be talking about that in my committee. So in the meantime, you still had to undergo construction on all that stuff. So what are you doing in the meantime to deal with this shortage of programming space?
Commissioner.
Mr. Chair, Senator Pappas, we've known, I think, from the very beginning that if we were going to wait until we had all the stars aligned and all of the resources necessary, that we would never be able to implement this policy. That said, internally, we have made a number of changes to how we deliver program services. And the largest part of this is really focusing on the individualized needs of people. In the past and historically, if somebody needed substance use disorder treatment, oftentimes it was long or very long. And now what we see is we have some people who come into the system who may have completed treatment and had a period of sobriety, and then get committed to the Department of Corrections. And in that case, historically, we would not use that treatment and we would start them over. What we want to do now is really making sure we're targeting our treatment to their assessed need. And so we have people now, and we're delivering, we've expanded our treatment capacity without really adding additional people by really leveling treatment based upon individual need. We're also doing a lot of creative work around we have now been doing cognitive behavioral interventions training, which have historically been very successful, both in treating substance use disorder, but really criminal thinking. We've been teaching the operations of those programs, which is really a skill-based program, to incarcerated members of the population who are oftentimes people who have demonstrated considerable success and change, and they are jointly teaching that with a staff person. So we are looking at every creative option that we have to expand our capacity to deliver programming across the board to allow as many people as possible to take advantage of MRA.
Okay, thank you.
Senator Limmer.
Thank you, Mr. Chairman. I too share the same concern that the chair has regarding STS and the state pulling away their resources from counties. Have you heard of And I think it probably works, it would work without state funds by perhaps the larger populated counties, but have you heard any resistance or advice from outstate counties that are using STS? Is that becoming a financial hardship for them? I believe that STS is sentence to serve. It's alternative sentence instead of prison or jail time. Usually, at least on the county level, it's for low-level or first-time offenders. But it would be a significant cost to local communities if it was not replaced with some other funding source. So have you heard of any resistance or concern from outstate counties?
Commissioner.
Mr. Chair, Senator Limmer, we have heard certainly some concerns about the reduction in that funding. I think what we've seen is every biennium, as we enter into the contracting process, we see the number of counties beginning to drop off. And some of that's simply because it has become harder and harder for them to get people onto these crews. And the crews are used, as you pointed out, in ways both almost like an alternative to community work service that may, on a Saturday or Sunday, people may be sentenced and actually work off jail time. The other way that many counties have historically used it is to actually allow people who are serving their jail time to work the crew and effectively have double credit, like credit for being in jail today and credit for working on the crew. When STS started, and I remember this so very well because I think it was so welcomed and the jails were under tremendous pressure with populations, as was the state at that time. The state provided 50% of the funding. Over the course of time, that funding has gone down, and now the state provides 25% of that funding for the counties. And I think to your point, Senator Limmer, is that, you know, some counties have had really an ability to really keep those crew sizes up, which really then reduces the cost per client per day and can have an impact on their bed space in their county jail. But many of them have seen, you know, crew sizes of 1 or 2 people. And when you start to look at the cost per client per day, it becomes very challenging. I think the issue for some of the counties is that, you know, if they're realizing real community benefit in the work that's being done by these crews, that's where I think they have been willing historically to pick up more and more of those costs. And I think the counties that are pulling out of the program have found that that the investment has not produced the return that they had hoped.
Mr. Chairman.
Senator Limmer.
One other area I wanted to inquire about. On page 12 of your presentation, there's a 9 or 10-year-old reference to 1% of the population. I'm assuming prison population is accountable for 63% of all violent crime convictions. Is that one, first, do you have any more recent information about that, or is that a standard figure that transcends time? And then second, would that 1% of, I guess, chronic offenders, are they eligible for the MRRA consideration?
Commissioner.
Mr. Chair, Senator Limmer, I think it has always been, I will double check that number, but I can tell you that across the board, and it has been historic and really well established, that a very, very small percentage of the population produces and results in a high percentage of all crime that gets committed. As to the question about MRA eligibility, would they be able to realize the benefits of MRA? The answer is yes. But in order to do so, they would have to make considerable investments, both in time, programming, and effort in a facility, and demonstrate that change in order for that to occur. And I can tell you that even on the prison side, as we look at prison misconduct, once again, a very small percentage, probably under 5% of our population produces over half of the disciplinary incidents that occur within correctional facilities.
Thank you.
Senator Westrom. Senator Westrom.
Mr. Chair, question on the sentence to serve. Did I understand you correctly? Your proposal is to end or stop the expenditure from the state? And if so, what's kind of driving that? And I heard you say the numbers are down, but with what I think has been a successful program for giving prisoners an opportunity to, one, get out of jail, two, do something very constructive, three, learn themselves some trades that are very helpful when they do get let out for serving their sentence. And four, a lot of more affordable houses are built out in my district. Alexandria area has had a very successful sentence to serve over the years. Senator Ingebrigtsen talked about it many times as a senator, but he was the former sheriff. So I'm kind of just trying to give me the understanding of why we'd be doing that rather than focus on getting more prisoners enrolled in it if the numbers are down right now from 5,600. If you can give us some more context, that'd be helpful.
Mr. Chair, Senator Westrom, I think as we look at what's happened, I think you can see that there has been some reductions in jail populations across the state. Certainly, some of that's reflected in what happened during COVID. But even afterward, we have seen those numbers go up a bit. I think the core question really becomes what drives the ability of counties to get those bodies out of the jail and onto these crews. And I can't answer that specifically, but I do think that this has been a challenge over the course of time for both the counties, just given the fact that, again, some of this is driven by the fact that counties decide whether or not they want to participate in this. And given that some of the funding has gone down over the course of time from 50% to 25%, we've seen some reductions. But on the whole, I can't give you a specific answer for why, but let there be no doubt that I think STS has served a great purpose. We see it with the ICWIC crews, the crews that the DOC operates, and some of them in greater Minnesota counties. But in those cases, not only are we providing funding for the crews, we are also paying a per diem for that. So there is a level of double cost to the state. So as we look at this issue of the STS crew size, I think the question really boils down to the efficacy and the return on investment for the state. And we're not saying that certainly in some counties where the crew sizes have been able to be maintained, that there isn't a benefit. But those counties may also be able to take that 25% additional investment. And if they're yielding the kinds of outcomes that they hope to have a lot of public work done by these crews, that can continue. We know of one county right now that does not take or receive any state money, but they continue to invest in STS on their own because for them, it has been an important way to complete public works.
Senator Westrom.
Mr. Chair, thank you, Commissioner. So do you know, would the program go away, or would some counties continue to do it with or without funding? Do you know any insight on that right now?
Mr. Chair, Senator Westrom, we believe, and we, as I said, there's one county for sure right now, and we know that some of the counties who really yield the benefit from this public work done by the crews would likely continue that on their own.
So, Mr. Chair, final question
Senator
or
West.
comment, Mr. Chair. Commissioner, I guess for the 1.8 million you said it costs, I'm just wondering if there's a different paradigm we should look at in rather getting those numbers back up, because I think there is a direct correlation with recidivism, and a lower recidivism rate, the more you can have somebody making a living, having a learned trade that maybe they didn't know before when they came into prison, and expanding those horizons for that little bit of money seems to me would pale in comparison to the cost of just a few inmates that would otherwise be coming back through the system and costing the state. And so I'm wondering if there's ways we could encourage, I don't know, maybe even a little more good behavior off of the end of their sentence if they really show to prove. I'm just wondering if the leadership we should be putting in is improving this program rather than cutting the funding and saying, well, it's not working right now, because I think there's a lot of positives I have heard over the years that I mentioned earlier, that I just wonder if we should look deeper at this before cutting it.
Commissioner?
Mr. Chair, Senator Westrom, I appreciate that we can continue to have conversations with our county partners across the state as it relates to this. As we face some significant financial hardship, I think that while it may not be a large amount of money, the reality is when we start to look at that return on investment and the demands that we face, I think we really felt like the question around the efficacy of this and the effectiveness of this and the return on investment does really raise the specter of the question about continuing the program. That said, we would certainly encourage and work with counties to look at reassessment of this, but right now, this does make good sense from an economic perspective. And we don't have significant data that says that placement on an STS crew in and of itself effectively reduces recidivism. We certainly believe that there is a benefit to community connectedness that occurs, and some of the skills that get learned from the crew leaders and members of the crew for people who are assigned to it. But I think, it is important that we are always asking the question about effectiveness.
Members, we're a little past committee time. We're going to take about 5 more minutes, and then if you have any follow-up questions, you can certainly speak directly with the commissioner. Senator Umer Verbit.
Thank you, Mr. Chair. Thank you, Commissioner. I saw on the implementation efforts, DOC data infrastructure overhaul, and I was just curious if you were trying to seek any federal funding for that. I know there was discussions about potentially securing a new network, and just with everything that is happening, just wondering if there's federal funding that was potentially being sought, if that's still available, and would just love to know a little bit more about how that is going.
Commissioner.
Mr. Chair, Senator Murphy, and thank you. I think there was not federal funding sought. There was not availability of dollars for that at the time of that initiative. As we talked about, that was we're replacing a 30-plus-year-old legacy system that was custom built. I can report that just last week we finalized the contract with a vendor to do a customizable off-the-shelf solution, which has been used in a number of other states and has proven to be effective. So we are really feeling positive about that. As you know, with any large scale project of this size, it's going to take us some time to fully implement. It'll, over the next 3 years, it will take to do that work. But we are really excited about that, and I can tell you unequivocally, our staff and our, frankly, our county partners across the state are excited about that. Because one of the things we know is that we can use data to be smarter in terms of the services we deliver. We will be better off, and that's really what this data infrastructure initiative is all about.
Senator Kroon.
Thank you, Mr. Chair, and thank you, Commissioner. I'm looking at the governor's budget recommendations for the Department of Corrections on page 29 on fraud against public programs. And it says the governor is dedicated to identifying, disrupting, and holding accountable those who use schemes illegally to prey upon state programs designed to assist Minnesotans in need. Yet on page 30, you anticipate only one extra bed this year and 2 extra beds next year for fraud against public programs. And so I've been reading the news a lot. That doesn't seem like a very high number to me for the amount of fraud that's been going on. Could you tell us a little bit more about the proposal and how you arrived at those numbers?
Commissioner.
Mr. Chair, Senator Kroon, the specifics of the proposal from a statutory standpoint, the elements of the crime and those sorts of things, I would defer to the Department of Public Safety. We, on our side, working with the Minnesota Sentencing Guidelines Commission, are tasked with developing the fiscal notes related to that. And while certainly we've heard about some of these fraud instances, and we've had a number of people prosecuted, some of them on the federal side, and the federal prosecution where there may be federal dollars behind would largely be continued going forward. So a lot of this would really focus on those who are charged at the state, charged and prosecuted and convicted at the state level. And it's an averaging of average daily population. So it's hard to say that one bed is equivalent to one person because depending upon the length of that sentence and how and when it's served, that's what ultimately impacts it when you look at bed utilization over the course of that time. So I'm not giving you it's hard to really precisely say that's one person is one bed. We have to look at this from an average daily population standpoint.
Senator Kroon.
Thank you, Mr. Chair. And yeah, thank goodness for the federal prosecutions, and hopefully they'll continue. It still and I understand it may not be a one-for-one from bed, meaning one person, in that it's averaged out, but it still seems like an awfully low number to me if we are truly taking fraud seriously and are not going to tolerate it, as the governor seems to say in his proposal. But my next question on that is if under the budget proposals and what's being anticipated here, if these crimes here would also be eligible for the MRRA, serving only 1/2 of the sentence.
Commissioner.
Mr. Chair, Senator Kroon, yes, the way it is established, that again, if people do the work and demonstrate the change, which is the state's objective at the end of the day, to one, both hold people accountable and to ensure that there is a meaningful and effective intervention, and that change is demonstrated, they would and be eligible for MRA.
So also note that these frauds, when they are found out, they are complex investigations and lengthy investigations, and then lengthy charging and prosecution processes. So you're talking quite a long time frame there, several years anyway. So shorter term bed impact would be harder to predict. You're looking longer term bed impacts really are what you'd be looking at. And of course, you get further down the road, it's even harder to predict numbers. So we might see much more of an impact 3, 4, 5 years down the road. Senator Kroon.
Thank you, Mr. Chair. It does go out 2 more years after that and just says 3 in the outlying years. So even those aren't very big when you start, we're looking out 4 years. And I would note too that in page 30, you said it's beds and it doesn't average out to one individual, but the actual language in here, and I don't know if it's a mistake or not, does say 1 individual in fiscal year 26, 2 individuals in fiscal year 27. So it seems to be a little bit inconsistent with your explanation. I don't know if you want to say which one is accurate.
Either that or they think there's less fraud out there now than some others seem to think there is out there. Commissioner?
Mr. Chair, Senator Cruan, and I would stand corrected that bed and person do not always match. So 1 bed does not equal 1 person. So this, the slide is an error.
I'm going to ask staff to distribute a poster that I had printed up. You recall the last, thank you, Commissioner. I don't think there's anything else from the DLC. Appreciate that.
Thank you.
Oh, Senator Howe. Okay, real quick.
Thank you, Mr. Chair and Commissioner Schnell. I don't expect you to have this information at your hands, but I know that there was an individual that committed a school shooting in my district that killed 2 young people, who now is up for a hearing to get released here this month. Can you tell us how many of these folks, young people we have that are getting this early release because of the change in our laws to allow early release if they've been committed for 1 life sentence, 2 life sentences, 3 life sentences? Because I know they've gotten their sentences shortening, they're getting their hearings. I would just like to know how many of these people are actually getting those hearings set up and how many folks are going to get released.
Commissioner.
Mr. Chair, Senator Howe, I can tell you that there's, just because there's a hearing does not mean there is a release. I think it's, first and foremost, it is, speaks to the eligibility for supervised release consideration. I can tell you that, and we'll get you the exact numbers of cases, but I can also tell you that as of now, I don't believe there has been anybody granted supervised release in accordance with the statutory change. That said, there are a number of them who have been reviewed for release.
Senator Howe.
Thank you, Mr. Chair. Thank you for that, Commissioner Snell. I will just say that it's a heightened concern in my district. My kids went to that school. They were in the school when it happened. There's a big concern about whether this individual is going to get released, and individuals like them. So I would be interested to know how many of those hearings are coming up, and I appreciate that information when you get it. Thank you.
Thank you, Commissioner. So members, you now have in front of you what I have had distributed about the Center of the American Experiment. You will recall they testified here at a previous committee hearing, and they were very clear that they are a non-political, non-partisan institution. In fact, I asked the question very specifically, and that was the answer we got. While the hearing was still going on, this poster was forwarded to me, which by the Center of the American Experiment, very explicitly attacking the DFL party and the governor. And since that time, I've received many other communications that also identify the Center of the American Experiment as explicitly partisan in its attacks in Minnesota. They are a 501c3 educational organization, as noted on page 2 of this. And honestly, it looks to me like they're getting awfully close, if they haven't crossed the line, between violating their tax-exempt status with the kind of partisan political activity they've actually engaged in. So I just want to make sure the record reflected that it was quite different than what their testifier stated in response to the question. Senator Limmer.
Mr. Chair, being a member of the Elections Committee, if one was to violate their 501c3 status, which is a nonprofit category under tax law, one would have to make the statement that they are either endorsing a candidate or supporting or not endorsing someone in the course of an election. But they are allowed to inform the public of what really is going on in their perspective. And quite honestly, I can't share the view that you have. They are informing. I don't think there's anything inaccurate here. They're making reference to the missing House members in the Minnesota legislature, and they're interpreting that as a potential government shutdown. If the House members continue to not show up, there will be a government shutdown. So quite honestly, 501c3 allows them to inform the public of a variety of issues facing state government.
Thank you, Senator Limmer. Members, the next hearing will be Wednesday, February 5th. You should also note that on Friday, February 7th, to accommodate a specific need from the Commissioner of Human Rights, we're going to have a 1-hour hearing from noon until 1 on Zoom as the Commissioner is about to go on leave, and this is her only availability. Friday. This coming Friday, from noon until 1. That will be a remote-only hearing, so you don't have to be here in person for it. And then finally, members, there will be a law school for legislators on this Friday, the 7th, and the following Friday, the 14th, from 1 until 5 p.m. For those of you lawyers, I think you might be able to get CLE credits for it if you chose to do that. But either way, if you haven't been through it before, it's a great way to learn a lot about not just the law that affects us in this committee, but all across the policy spectrum. With no further announcements, members, we are adjourned. Thank you.